next we have Dr. Cuzalino, who is a board-certified plastic surgeon from Oklahoma. We are going to be discussing butt augmentation and buttock aesthetics. Very nice to have you.
Thank you.
Thank you. Thank you for being here. So tell us a little bit about your practice and kind of your interest in buttock enhancement and how you've grown that area.
Okay, well, I've been in practice for 21 years, and I do nothing but cosmetic surgery, and it's about 70% body, 30% face. But when I first started practicing, some bariatric surgeons approached me for doing a lot of post-bariatric. And so my practice started doing a lot of that, which included butt lifts. So I did a lot of formal butt lifts, and then of course, things have progressed now. You know, you have Jennifer Lopez, Kim Kardashian, and so instead of just doing the standard formal butt lift, people want bigger butts. So of course I started doing fat grafting, gluteal implants, and so now I do the, for the last 20 years, full range of buttocks implants, buttocks with fat grafting, and still formal lifts as well. So I love doing all of it.
That's great. Yeah, I mean, as we've seen in plastic surgery, buttock enhancement has skyrocketed in popularity. And along with that, you know, we have many different practitioners using different techniques. They're injecting fat in different places, and there have been concerns over the safety of buttock enhancement. So, you know, it's been popularized in the media because as more and more people are doing it, it's, you know, there are complications in non-experienced hands.
Absolutely. So, yeah, you're exactly right. And a few years ago, the plastic surgery study came out, and they had a death rate as high as 1 in 3,000 from fat emboli. So it really dropped the bucket out of a procedure that seems safe, and everybody was doing it, and everybody's still doing it, but they have to understand what causes this major complication, because if you get fat in the vein, especially those deep veins, the superior and inferior gluteal veins, people can die within 12 hours or less. And so it's critical to know what you're doing. It can be a very safe procedure if it's done right. But I think what happened was a lot of people were doing it, especially in South America, and they were just using cannulas as deep as they wanted, going deep in the muscle, and they injured the veins, of course, and they had that terrible complication. We started seeing it in the United States. And what I've noticed lately is that the good news is the trend is going back where it's safer now, or it appears to be. In a study I recently did, it was close to 1 in 4,800 about 3 to 4 years ago. The newest study so far, it was 0 in the same group of doctors, which probably implies the doctors finally learned, hey, we don't need to be going in the muscle. You know? And if you stay above the muscle, you don't aim the cannula downward, it can be a safe procedure.
Right, absolutely. Yeah, we looked at some of those anatomic considerations as well, and I think you're 100% right. You know, beforehand, people were just, just because it's a cannula and it's minimally invasive in a sense, doesn't mean it's always safe. So I think people were putting that cannula kind of wherever and putting it in muscle. And as you said, this was very popular in South America, in particular. What's that saying? Cheap plastic surgery is never good, and good plastic surgery is never cheap.
That's right.
And so a lot of times when people are, maybe looking for less expensive options, going to Mexico, Dominican Republic, there are good surgeons there, but there are definite areas where you can get into trouble if the practitioner doesn't know where to inject and what they're doing.
Right.
So what's your main patient population? Who usually comes to you for buttock augmentation?
Well, it's interesting. I'm in Tulsa, Oklahoma, and about half of my patients that are getting Brazilian butt lifts are Hispanic or Latino. Okay. And then about 25% are African American, Black, and then the other 25%, mostly Caucasian, but a little bit of a mix. But I give a lot of lectures on ethnic buttocks augmentation. And the reason why, those three groups, African American, Latino, and Caucasian, all desire a slightly different shaped buttocks. And if you give a Latino a Caucasian buttocks, they're not going to be happy with it. So,
yeah, that's why I ask you, because just like you said, the buttock aesthetics, we're beginning to define it more and more, but there are many anatomic considerations as far as where the hip is going to be most wide. Are you going to put most of the volume in the most projecting area or higher? And I think that's, just like you're alluding to, it's very, it depends on the ethnicity and the desires of the specific patient.
Right. In general, an African American will want a little bit higher over the midline portion of the buttocks. Caucasian, more in the midline, general round. The Latino wants a little in the lower third, and especially the outer, sort of in that greater trochanter depression. So you're giving them a little bit wider buttocks than you would a Caucasian.
And what's your preferred technique? Do you prefer fat grafting or implants or combinations, or how do you decide that?
Yeah, I like them all, but of course, the fat grafting usually is going to be great if the patient has adequate fat, and of course if they have fat in their hip area, they're going to get a great result no matter what, because you're making their waist smaller. That's always going to make a buttocks smaller. So I play it by ear on what the patient wants, their needs, and if they come in and they really just don't have very much fat, we'll go to the gluteal implants, which I do love. I think they're wonderful. There's some advantages to the implants in that you don't have to worry about resorption.
Right.
You aren't worrying about fat emboli. If you put it under the muscle, it can look very natural and normal. It is a little more sore, compared to the fat grafting, but I like them all.
Right, yeah, I think implants kind of got a bad rap early on. I think they were less sophisticated devices, and now as it's come back, it's kind of come back into popularity because there's a certain projection and look with an implant that it's hard to match with fat grafting, and I know people are combining it.
Yeah.
What do you usually tell patients about downtime?
Well, I tell them for the Brazilian butt lift, the fat grafting to the buttocks actually usually is not the sore part. It's usually the liposuction. So if I'm doing more liposuction, their downtime is going to be a little bit longer. I've been using a lot of medicine like Exparel, some of these long-acting numbing medicines.
That's great.
And I tell you what, it's really improved the recoveries for tummy tucks, especially for butt implants. If you inject all around the muscle with some long-acting numbing medicine that gives them 3 days of virtually no pain, they get back into things quickly where they can go back to work certainly within a week.
That's great of you. Yeah, Exparel, for those who don't know, is a liposomal bupivacaine, which is a long-lasting numbing medication. Lasts, I think, 3, 4, or 5 days. I mean, it really gives patients a lot of comfort. So, thank you so much. It's really been great learning from you and hearing about your technique. Thank you. Thank you.